Well, again, thank you everyone for being here. We're going to go ahead and get started. My name is Kristen Campbell, and I'm Executive Director of Philanthropy for Active Civic Engagement. And so thank you for being part of this webinar today titled How Health is an Issue of Democracy. I'm really looking forward to our discussion and our speakers today, but I want to get us started with a couple very brief, tiny bits of housekeeping. First of all, everyone who's joining us as an attendee today, you are on mute by default, but you can unmute yourself at any time that you need to ask a question, particularly when we get to the discussion portion of our session today. The second thing that I want to make sure that you know is that there's a chat feature as part of this webinar. So the gray box on the side of your screen, I encourage you to utilize that for questions, comments, reactions that might come up for you over the course of the discussion. In some of our past webinars, participants have found it a particularly helpful tool to share links or resources with each other about some of their work as it relates to the topics raised in the discussion as well. So certainly encourage you to utilize that chat feature. And then the third thing I want to make sure you know before we get started today is that this session is being recorded, and we will be making the video of the discussion available afterwards. So if there's anything that you want to refer back to, or any colleagues that might not have been able to join us today, you're certainly welcome to share the video link with them, and it will be available on our website at pacefunders.org. So I wanted to get started by telling you a little bit about why PACE wanted to host this discussion. PACE is a network of foundations and funders that invest in civic engagement and democratic practice. We have identified a shared belief across our members. It's a pretty diverse network. All different types of foundations and funders are engaged in it. But the thing that is really core to our membership and a shared belief that we all have is that America will be more healthy, productive, resilient, and successful if democracy is strong, and if the office of citizen is treated as central to how democracy functions. So what this means is that sometimes our members explicitly fund civic engagement. They have portfolios that focus exclusively on voter mobilization and education, or volunteering and community service, or community organizing, or participatory budgeting, what have you. But sometimes it means that their objective priority area is actually something else. But they inherently recognize that civic engagement and democracy building is a strategy through which that issue will be addressed. And so that's what really brings us to our discussion here today. We wanted to talk about how civics can be a strategy to greater outcomes related to health, wellness, and community vitality. And so we really wanted to do that by highlighting how two of our member foundations employ that exact approach in their work. So with that, I'm thrilled to introduce our two speakers. First is Earl Louie, who is Program Director at the California Wellness Foundation. Earl's portfolio focuses primarily on strengthening community clinics and safety net services, but with the larger goal of creating healthier community environments. One of the taglines that California Wellness Foundation often uses in their work that is particularly relevant for today's discussion is that health is more than just the absence of disease. So thank you, Earl, for being part of this discussion. Our second speaker today is Judy Sabbert. And Judy is president of the Heartland Foundation in St. Joseph, Missouri. The Heartland Foundation began as a traditional hospital-based foundation that has expanded its strategy over the years. I believe it was founded in 1982. I'm sure Judy will correct that if I'm wrong. And since then, they have expanded their strategy to really think holistically about community vitality in the region that they work in Missouri by addressing the root causes of the area's challenges. So that's just a little bit about Earl and Judy and a little context for what they might share with us today. How we thought we would start today's discussion is I will ask just a couple of broad contextual questions about how they think about the relationship between health and civic engagement, and ask them to share a few examples of that. And then we've reserved the majority of our time today to really be in discussion with you all to talk a little bit more about their specific experiences in doing this and what you all would like to learn from them in that. So with that, let's just go ahead and open it up for discussion. So Earl and Judy, you both work at foundations whose primary missions are focused around, Earl, for you, it's health and wellness. Judy, for you, it's community vitality. So while those are the specific missions of your organizations, you really view and realize and recognize that civic engagement and democracy are central to those missions. So can you explain for me how in your mind you connect the issues of health and democracy and how they really relate to each other?
Happy to do that, Kristen. I'll just jump in if that's all right.
Great.
At Heartland Foundation, what I'll say is we view health much differently today than we did when we started back in the 80s. And as you said, we started out as a very traditional hospital-based foundation, and we were all geared to raising monies for health and healthcare projects. And then we began to question our role in the early 90s because it became clear that in our region we had many issues. We had increasing issues of obesity, cancer rates were high, tobacco use rates were high, poverty was an issue. We saw a lot of depopulation taking place in the region, and it became very apparent to us that as a foundation, we needed to think very differently about our role, and that healthcare as we know it doesn't necessarily impact the health of the population. And so we began to explore different ideas and thoughts around ways to think about health. And it became very clear to us that what we should focus on was not necessarily medical matters. And so our foundation is not really about funding clinics or providing monies for hospital care and activities. It's really looking at ways that we can champion education and empower people. Because it's our belief that when people are empowered, when people see education and developing workforce skills for life, that those individuals are going to be much healthier. And then when they're engaged in community and they care deeply about those communities, we believe that communities overall will see an impact in many different issues or opportunities that look at indicators that impact the health of the population. So we began to understand very clearly what the Global Healthy Communities movement was about and started to endorse those kinds of opportunities and ways of thinking. And so health to us is understanding it's about education, it's about civic engagement, and it's about personal responsibility.
Yeah, pretty much ditto everything that Judy said. I think we as a health foundation have a similar view. You know, with our recently launched strategic plan, Advancing Wellness, that we launched about 1.5 years ago, we really also explicitly focused on social determinants of health and health equity. And so we take, again, like Judy was saying, a very broad view of trying to address health, that it's more than just providing medical care, but it's really addressing the root causes of people's health issues, which are often related to poverty, low incomes, just not enough opportunities, educational opportunities, levels of violence in their neighborhoods. So a lot of other environmental factors like unsafe drinking water, as we've seen in Flint and in many other places here in California also. Air pollution that also affects people's health. So there are a variety of factors that affect people's health that require more than just health medical care services in a community clinic, and also problems that need a lot more resources to address than any one foundation, certainly, or even all the foundations in a given area. That it really requires public dollars to address a lot of these issues, whether we're talking about providing better educational opportunities to people, providing higher income jobs or job training and opportunities, or of course, providing, talking about healthcare, providing more healthcare coverage to people, whether, through expanding Medicaid or local programs to cover more people. So all of that takes public dollars and public resources. And yet what you often find, of course, is that low-income communities, residents of low-income communities, and often communities of color, aren't engaged in civic life, aren't engaged in voting, and aren't participating in meetings and hearings and things like that. And so our foundation, we had for a long time funded public policy work by our grantees. So grantees that do community organizing and that do advocacy using their professional staff, using professional advocates to ask for things and ask for improvements in public life. But what I think we found, and also really what they found, was that was necessary but not sufficient, that you could do all the community organizing that you wanted to do, and you could do have professional advocates doing what they do, but it wasn't enough. And really what was missing was that grassroots involvement, and what was missing was actual participation by voters in elections, because lots of things are decided through ballot measures or other things that are on the ballot, and also who policymakers are and who they represent is important. And so if those communities aren't at the table and being represented by government, they're never going to get their fair share.
That's really interesting. Earl, you used a term that I've been hearing a lot more lately, that I want to make sure that we have a clear understanding of what it means, and that's social determinants of health. I feel like that's a phrase that's coming into the lexicon a little bit more, but some folks might not quite know what that means. Can you take a quick second and define that for us?
Sure, I can, and Judy, please chime in too. It's just one of those fancy jargon words that just really is common sense. I think it just means, it refers to all the conditions surrounding any individual or any community that affects their health. So it could be income, it could be racism, it can be rates of violence, whether it's domestic violence or levels of violence in the community. If people don't feel safe, they're not going to go outside of their homes. Levels of education and educational opportunity that people have. All the studies, all the data out there shows that, higher income people are healthier. They have better health outcomes. And there have been a lot of studies in the public health world about how zip code, where you live, matters more than many other factors in what your health outcomes are and how long your life expectancy is.
Mm-hmm. Okay, great. So let's talk a little bit about what this means when you actually put it into practice. So can each of you tell us about a specific project or initiative where you aligned civic engagement strategies with your health, wellness, and vitality objectives?
Certainly. And I would say that there are several things I could talk about, but probably starting with our Community Transformation Forum, it was a tool that we use where we gather people from all walks of life, different backgrounds, to gather, convene, and have deeper conversations about community, how they experience community and what they wanted to see for their community in the future. And I will tell you that as we engage people from different walks of life, we made sure that we had young people at the table. And I'm talking about middle school and high school students. And I think that was probably one of the best decisions we ever made, because we began to see that young people wanted to have a voice. They had extraordinary ideas, and they felt deep passion for the communities that they lived in. And I think probably one of the biggest frustrations we had was that even though we were getting really extraordinary, innovative thoughts and ideas from young people, we were just scratching the surface, because we're only engaging a handful of youth. And if you only have X number of forums a year, and you may have 20 or so students in the population of 75 or so people, you can see that several hundred people, we weren't going to get very far. So we began to think about how can we engage more young people in the conversation about being deeply involved in community and making a difference for those communities. So we created a place that's called Empower You. And it's a very special place. It's a place where we have an opportunity to engage middle school and high school students going through a challenge-based learning immersion experience. So they have the opportunity to work together on community issues, on health issues, and to explore very deeply what it means to be a change maker for that community. And learning how to work in teams in a way that they can think very critically about different perspectives and then coming up with answers that could have an impactful difference. They have access to tools and resources and technology so they can research while they're here. And in the process, they work as any other community team would in gathering information, exploring different possibilities, and then coming up with their thoughts and ideas about how to affect impactful change. And they can go through several different experiences, and it all leads to an opportunity for those that choose to take on real work within their community, where they actually select a service learning project, and we provide grant funding for those schools and youth groups that decide to take on real work. And they actually apply for funding to make changes within their community. So they're addressing environmental health issues, they're addressing physical health issues, anything that you can imagine, economic health, that is important to them, where they see that they can make a difference. And I think one of the things that's really important to understand, it's realizing that we have to connect with all kids. It's just not giving the opportunity to a few select students that are chosen to participate, but all of these students that we have coming here, it's part of a whole entire class, because we see that each of them needs to feel empowered, they need to feel like they have a voice, and that they can make a difference for their communities. So it's an opportunity for them to work together, to see the power of their voice, and to also feel that the adult population is listening to them, and that they can really take on things that matter deeply and begin to address matters of importance for a community.
And if I'm not mistaken, you're actually sitting in an Empower You classroom right now.
And we call the classroom the collaboratory.
Laboratory.
So students begin to realize when they first come here that in this learning lab setting, that it's not like a traditional classroom. This is a place where we do real work. It's very much challenge-based, but it's an opportunity where they learn to collaborate in a laboratory setting. And it's very interesting to see, because what we experience is that young people that typically are disenfranchised in the classroom, perhaps do not do very well, at-risk students, probably thrive as much, if not more, than the students that are, let's say, straight A and considered leaders in their classroom. So it really is an empowering opportunity, as well as connecting them with the importance of being civically engaged in their community to make those differences that will be impactful for the future.
That's great. That's great, Judy. Earl, do you want to share an example of a specific project where you've aligned civics and democracy with your health objectives?
Sure. Well, in 2014, we joined a group of other funders called the California Civic Participation Funders. It's a group of 10 foundations doing work here in California on civic engagement. And specifically what that means is this group is working on voter education and registration. in parts of California that are undergoing a lot of demographic change, and where low-income communities of color, again, tend not to vote in the numbers that are, that they make up of the general population. And so this group of funders got together to try to work collaboratively in a couple of regions in California, the San Diego area, the Inland Valley regions in California, Riverside and San Bernardino counties, and also Orange County. And all those counties have undergone a huge demographic change in the last decade. So, for example, Orange County, which again a lot of people probably around the country still think of as a mostly white Republican area, is actually a majority people of color region now, and yet a lot of the policymakers and office holders in those locations don't reflect that changing demographic. And so a lot of those communities and the residents of those communities feel like their interests are not being well represented. And so increasing voter registration can help try to change that. And so the foundations that we work with are all involved in this kind of effort. And I know a lot of foundations and 501c3 organizations sort of, as soon as they hear voter and elections, there's this fear factor. And the truth is that 501c3 organizations can do nonpartisan voter registration, and foundations can fund that work. And so we've seen that as an important work to try to change the way policy discussions are framed and discussed, in these regions of California. And so this group of 10 foundations includes a few large foundations in the state, like the James Irvine Foundation, the Walter and Evelyn Haas Jr. Fund, the California Endowment, and a number of other foundations. And they all come from different areas. They're not all health foundations, though some are, but some of these other foundations care about immigration rights, LGBT issues, education. So they come from a variety of funding issues, but have all seen the need to make progress on these issues. One key is to try to get low-income communities of color more civically engaged. And so we've all joined together to try to do that.
That's interesting. That's one thing I think appears to be a little bit of a trend in philanthropy lately, is foundations seeing the intersectionality of a lot of various issues, right? And if you care about one, then you need to care about the other, because there's an overlap and an integration between them, which sounds like is reflected in the type of work through the collaboration that you just mentioned. Those are both really helpful, specific examples. If we were to take that up a notch to a little bit of a higher level and say, how does that specific project reflect the values of your foundation, especially as it relates to democracy? How would you say that project is a reflection of those values, and what do you really feel that those values are?
I'm going to try and pull a slide up that hopefully can help to explain that.
Got it, Judy?
If we can go back, it's the very first one, Kristen. There we go. What you see is really a model that we created. This has been tweaked a few times, but we created this back in the 1990s. And it's our way of thinking about what it takes to drive healthier, more thriving communities. And the way this works, it starts at the bottom of the page. And as you will see, our mission is really about championing education and empowering people. And in our role as a foundation, we serve as a catalyst, a convener, innovator, and really kind of a what you might call a quiet influencer. And so on the next level, you will see that we have a number of different things that we believe need to be in place in order to move things forward. And that means cross-sectoral collaborations. It's about leadership development. It's about finding those opportunities to work and collaborate together. And then at the next level, it takes in consideration the types of things that we value, things that we would consider the core values and the intangible capital, if you will, of the foundation. So it's understanding the importance of diversity and inclusiveness. It's having more of an asset thinking mentality versus a problem-solving orientation. It's about civic empowerment and looking for those opportunities to think about the possibilities of the future, to think ahead and to take a longer view. And also the partnerships. The partnerships are extremely something that is essential and is of a critical nature to the foundation and those that we work with. All of that leads to the fact that whatever we invest in, we want to make sure that it's all aimed at understanding that it's about accepting personal responsibility, personal responsibility for your life, personal responsibility for your community and beyond. And to when that happens, we believe it will lead to citizens that people who live in our communities that are highly educated, the workforce that is prepared, and when all those things come into place, we'll see people that are healthier, more engaged citizens and community contributors, quality of life enhancements, and the vitality of that region in a much more healthy way. So that gets us to what we consider the tangible assets. And so taking that all in consideration, it's a long-term view, but what we hope to see in the long term is healthier, more thriving, more vital communities as a result. I think that's embedded in all of our programs that we have here at the Heartland Foundation.
I can just give two quick examples. One of the issues we as a foundation care about is improving access to health coverage. So either expanding our state Medicaid program or having local programs at the local, say, county level cover more people, including the undocumented population. And so that's an issue there where, again, if people are civically engaged, at a local level, they can help their policymakers see the need for those issues and make some change happen at a local level. So another example is in the environmental health area, safe drinking water is a huge problem in rural parts of California, in the Central Valley, in the Coachella Valley, and other really low-income, underserved areas. And a lot of the problems there stem from underinvestment, inadequate investment in drinking water infrastructure and creating safe drinking water facilities for drinking water in those kinds of communities. And so that kind of lack of public investment, again, if policymakers in those regions aren't representing the interests of communities that are affected by those issues, that's a problem. And so having people civically engaged can try to change that.
That makes a lot of sense. You both make it seem so easy and so natural. So can you maybe talk about some of the challenges that you have experienced in trying to integrate a civic lens into your work, and maybe to end at least this part of the discussion on a positive note, maybe one of the biggest successes that you've experienced as well?
Judy, do you want to take that one first?
Yeah. As I think of the challenges, certainly there have been challenges along the way. Oftentimes we're talking about new ways of thinking, and not everybody's really ready to join that bandwagon. I'll be perfectly honest with you. And so we have to appeal to people in a way that they're ready to take that next step. And oftentimes, we understand that, in a way, you have to believe it before you see it. And so there are times when we have to wait. There may be some partners or individuals that simply aren't ready until you're down the road a little bit further. And we have to be open to that. And I think that in our case, that we also look at things in a way that schools that we engage in oftentimes have difficulty funding their experiences, so funding can be a big issue for us. So we have to try and find creative ways to help schools and others to participate in the programs and activities that we provide. And sometimes even finding partners for schools to participate in can be a challenge, particularly in the case that we're serving a very large region. We encompass 30 counties in mostly Northwest Missouri, but also parts of Kansas, Nebraska, and Iowa. A lot of these are very small rural communities that really struggle and have had many different kinds of issues that they've faced in the past, economically speaking, loss of population. And what we're trying to do is find opportunities to connect with those communities, to provide some inspiration for hope and look for ways that we can think differently moving forward. So I would say, to some degree, the fact that we take the longer view is not always something that a lot of people are ready for. They want to see the quick fix. And so we try and find some short wins, if you will, but at the same time, we understand that what we're looking at is all about generational change, because we still have pockets of poverty. We still have concerns with health issues. We still need to raise educational levels. But if we can invest in our young people, if we can invest in their future, and if we can help them to understand and see that they have a future here and they can be a part of making extraordinary communities and better lives for themselves and their families, then that is our hope as a foundation, is making that connection for generational change and understanding that we have to stay the course and that this is a lifetime commitment.
Earl, challenges and successes before we open it up for questions from our attendees?
Yeah, I think the challenge for us, we did a lot of, before we formally joined the California group, the California Civic Participation Funders, we kind of sat in on their meetings, and we had to learn a lot about what they were doing and get comfortable ourselves with, is this really okay with, supporting voter engagement, voter registration type activities. And, so it took us a while, but, the fact is that it is okay. And so it became easier when we saw, lots of our peer foundations doing this work and the kind of work that they're doing. And also, I think that our grantees, many of the, before we formally joined the coalition, the collaborative, a lot of our grantees who had done community organizing work and public policy work had already been receiving these kind of civic engagement grants from these other funders. And so we started to hear about it, the work from our grantees, even though we weren't funding them for that kind of work, for the voter engagement work. We started hearing about them doing this work, and some of them even starting 501c4 organizations, to really do political work. And so we saw that as a trend that, it seems like the field is moving that way. So not only are foundations moving towards that direction of voter and civic engagement, but certainly the nonprofits see that as a new tool to add to their toolkit, in addition to all the other things they do, that engaging with voters was really core. And so for us, it was just a matter of getting comfortable and understanding the work and the field. And since we've done that, it hasn't been that huge of a stretch or for our board or for our CEO to say that this is really key to our mission. Really, because a lot of the communities that we work with, the issues that they face, they're all facing the same sets of issues, right? Poverty, low educational attainment, crime and violence, often polluted environments, just unhealthy living conditions. And at the same time, they also have low rates of voting and civic participation. So, is there a correlation there? Is there causation there? And so, and I think when we think that there is. And so in addition to doing all our other work, civic engagement has become, part of our toolkit also.
That's great. Great. Are there any participants on the webinar that would like to speak up and ask a question? You can unmute yourself and ask it live, or you can type it into the chat box and we can relay it to the presenters. We'll give folks just a second. Well, while folks are thinking about their questions, and we certainly want to hear from you, so please do consider speaking up and asking one. I know sometimes it's hard for us to see you since we're on a phone call, but please don't hesitate to speak up. But one question I guess that I have is, you've both talked a little bit about kind of the policy environment that you have needed to work in, and in the last couple of years there have certainly been some changes in the policy environment through the Affordable Care Act and healthcare and any number of health related issues becoming more of a regular part of the public dialogue. Can you talk a little bit about how any of that has affected, or either in positive ways or in challenging ways, your ability for you to do your work?
Well, fortunately, we are attached to Mosaic Life Care, which is an integrated health delivery system, and obviously very much impacted by Affordable Care Act and doing many great things in that arena. I will say that because we've had the long-term view and we've been involved in this work for a couple of decades, that we continue to get that endorsement, and the larger parent organization, if you will, continues to support and embrace our work so that we're able to address those social determinants that Earl talked about earlier, because we believe it all goes hand in hand. And so if you are not looking at those root causes, it's very difficult to impact the health of an individual or the health of a population for the long term. So we believe very definitely that it's worth that investment, and continue to get support in many different ways to do just that.
Yeah, just real quick, I think with the ACA over the past couple of years, there has been, I think, just a lot of renewed energy, especially here in California, where we're I think pretty successful in implementing it, but there's still a lot more to be done. But as Judy mentioned, I think the ACA also, what a lot of people don't realize is that focuses a lot on prevention, right, on going further upstream. And so I think that that whole movement to in the public health world and in health to go upstream, I think just fuels the need to look broadly and to connect the dots and to include civic engagement as part of the strategies that health funders work on. And so I think sort of the policy environment over the last few years is definitely conducive to folks getting out of silos and doing that.
That's great. Earl, there's a question specifically for you about some of the campaigns that you have funded, and kind of related to the discussion that we're having right now. What have been some of the policy change goals of some of the initiatives that you have worked on?
Okay, yeah, I was looking at that question too, and as I was listening to your question, and so so I can sort of talk about how we're organized and how we fund, because I think that helps. So we have so I oversee an area called Fostering Healthy Environments, which is sort of like our healthy communities work, and also a second area related to community clinics, as you mentioned. And so and each of my colleagues here has two portfolios like that have work on various issues, and we all fund community organizing and policy work in different ways. And then separate from that, the civic engagement work that we funded has been funded by our director of public policy, and some of the funds for those grants have been I've basically co-made those grants with our director of public policy, because many of the organizations that have received those civic engagement grants have been grantees that work on healthy communities work, that they do a lot of community organizing now. So for example, some of those groups are groups that that work on environmental justice issues that already, like I said earlier, have already been doing community organizing for a long time, but are trying to do things like, close down polluting sites and businesses, in low-income neighborhoods of color, and try to create more healthy, planning, city and regional plans that incorporate health as a consideration for making planning and zoning decisions. I mentioned safe drinking water is a huge issue in the Central Valley. So, again, trying to fund groups that work in communities affected by unsafe drinking water and funding their public policy work. So it's been a variety of issues, but the civic engagement, specifically the grants for civic engagement, have been to organizations that do what's called integrated voter engagement work. So basically trying to integrate the idea of contacting voters and keeping in touch with voters, not just during an election, but kind of integrating it throughout the ordinary or the work that nonprofits do. So in other words, if a nonprofit's already holding community meetings or going door to door with people talking about a specific issue, well, they should also talk about voting. Are you registered to vote? Here's how. And then talking to them about why it's important to register to vote and to participate in civic life. And so that integrated civic engagement work is something that a lot of nonprofits have added to their toolkits. And so that's what a lot of our grants have supported.
Great. Questions from others? There's somebody? Okay. Well, if you continue to have, here we go. Judith, how much money do you give in small grants, and what is your selection criteria?
We give grants in a number of different ways, but one of the opportunities is a program we call Jump Starters, and it's specifically designed to provide funding for service learning projects that youth take on. And we have a pool of funds that we have access to. And so it's not a certain amount that we award during any given year. It's just as those requests become available, then we look at those on a competitive basis and make decisions when the youth apply for those funds. And what I will tell you is the dollars that have been granted will range anywhere from $1,000 to $10,000. Now, take in consideration, that's $10,000 that is awarded to 6th, 7th, and 8th graders to take on real work. And so they have the responsibility to prepare the grant proposal. They have the responsibility to identify the need, how they plan to address the problem that they're proposing, to set up their goals and outcomes, to determine what the evaluation will be, and then also to come up with that budget. They also have the responsibility to manage those funds and then report back to the foundation on their progress. So it's really a wonderful learning opportunity for young people. It becomes an educational experience, and at the same time, we believe it's helping them to understand the power of their voice and the difference they can make when they become involved in these kinds of projects. We also have another fund, which is called Healthy Partnerships, and those are grants that will range up to $25,000, but it's to engage collaborative partners from throughout the region to think in terms of how to impact the health of the population in new and innovative ways. And we're currently going through that process right now. It's been a program that's been on a part of our toolbox now for 25 years, and it's funded some pretty extraordinary opportunities. And I think one of the things that's come out of that is the fact that people have started to begin to realize the importance of collaborating with diverse partners and to think about new ways of doing things so that we can come up with answers that hopefully will have a positive impact in multiple ways down the road.
All right, last call for one final question before we move to wrap up, if anybody on the webinar has one. Okay, here's one that just came in. What are some examples of topics that you cover with students in the civic courses, and have there been graduates? So presumably an extension of the have there been graduates piece would be what are they doing now, and what impact has their participation then had on them as leaders and adults?
In our case, we have not tracked students over the longer term, other than when we have young people who come back and share with us what they're doing. We do have some older students that are working on different projects, and I'll give you an example of one right now. They have taken on the issue of suicide prevention. It has been a real concern in our region, and so we've had a number of high school students who are part of our servant leadership team who have created a video, if you will, and it's something that they plan to make available to distribute really to schools and communities throughout the community or throughout the country as a way to address a very serious problem that we face, not only in our communities in Northwest Missouri, but certainly across the state of Missouri. There have been numerous issues related to suicide. And so I think what we have discovered is that when young people address those kinds of issues, that it empowers them in a very deep way, and it helps to influence the decisions they make for their next steps, if you will. And we're finding that they're becoming more deeply engaged and continuing the work, and really see the importance of making those connections to people from different walks of life, because we feel that's an important value to see the importance of diversity and inclusiveness. And I think I've just lost power.
We can still hear you. I can still hear you. Earl, can you still hear Judy
Yes.
too? Oh yeah, okay, great. All right, well, one final question. This has been a really interesting discussion. I think you guys have raised not only some really interesting points about the intersection between a lot of these issues, whether it's the environment, poverty, health, public safety, any number of other issues is important, but also something that really holds a lot of promise, I think, which is the integrated civic engagement into all sorts of actions and solutions for lots of issues within communities. So as we move to wrap up, I have one final question for you both. You have both expressed, at least to me, that you would like to see more foundations investing in civic engagement and democratic practice, regardless of their priority focus areas. For the foundations that are maybe on the call today and are thinking about how they might do that, what piece of advice would you give them, or encouragement would you give them as they think about how to set out on that integrated civic engagement type journey?
Well, I'll take that. So I wanted to just plug this report that the California Civic Participation Funders recently put out. I'll show it here, Bolder Together too, and I can give you a link to that. But that report really talks about how our foundations, the foundations that make up the California group, started and did their work, and the lessons learned. And so this is the second. It's called Bolder Together 2 because there was an earlier report 4 or 5 years ago that right at the beginning of this effort, and now this second report kind of captures some of the lessons learned. And so I just recommend this report as a way to do that. I can't try to summarize it, quickly, but I would just say that there are funders who do this, and I think any of them would be would be happy to, I'd be happy to talk with anyone individually to share more about it. But it's been really a good journey for us, and the early results that we've seen in the regions that we worked with have been really positive.
Great. Judith, you haven't lost power, so do you want to give us a piece of advice or encouragement before we close up?
Well, and I know we're running short on time, but I might suggest that you take a look at a new publication that we just released through the Heartland Foundation, and it's called Come Together, Think Ahead. And it's also an opportunity to explore kind of the journey that we've had over the last couple of decades. It shares inspirational stories, lessons that we've learned along the way, and some of the things that we're considering for next opportunities down the road. So you can go to the Heartland Foundation website at heartlandfoundation.org to purchase the book, or you can also go to amazon.com. Again, it's Come Together, Think Ahead, inspiring people, organizations, and communities to thrive.
Great, thank you. So we're coming together to think ahead. We're being bolder together as two resources to check out as a direct result of this conversation. I want to thank Earl Louie and Judy Sabert for being part of this discussion and sharing your wisdom and insight and learning with all of us. I want to thank everyone on the call who has been part of this discussion. PACE does webinars every other month where we try to highlight interesting things that our members are doing and generate thoughtful conversations with others that are interested in learning and engaging around those topics. So as you get off the webinar today, you'll get a quick survey about this experience. And one of the questions on there is, what topics would you like to see us explore in the future? So please take a moment to consider filling out that survey and giving us your feedback. And with that, I am going to thank you all again for being part of this. The video will be available on our website probably by the end of the day tomorrow. And with that, thank you again so much, and everyone have a great afternoon.
Thank you, Kristen.
Thanks, Kristen.
Thank you, Judy. Thank you, Earl. Thank you all. Bye-bye.